When it comes to choosing a medical provider, it can be difficult to know who's best and what kind of care you might be able to receive. There is experience, training, many things to consider. All things being equal, could come down to the doctor's philosophy. Here to talk about the approach at Tulsa Spine and Rehab is Dr. Sean Riley. So, Dr. Riley, when people ask you the approach of you and your staff at Tulsa Spine and Rehab, what do you tell them?
Yeah, Scott. So, philosophy is one of those things that, especially with chiropractic, gets thrown out so very much. And I try to avoid, that word philosophy, because everything that we do here is science-based in the clinic, and, we want to use research and all the new, the latest and greatest of technology and forms of treatments to treat our patients. But my whole thing is with the way I explain this to patients when they come in, the two things. It's so very important that you get a proper diagnosis of what the problem is. And that's why that first visit is so very important. Because if we don't diagnose the problem properly, then obviously, on the back end of that, you can't treat it efficiently or effectively. So I think it's important that you give a patient the correct diagnosis of what their problem is. And if you're unable to do that, then you need to send them to someone else that can. And this is the second part of this might, confuse some of the folks out there, is that, a lot of times when you go to a chiropractor, it's kind of like it's a lot of the same. You go in and they do a history and they do an exam, and they're likely going to shoot some x-rays. And we've talked about, we try to avoid, the x-rays if possible. And then that's it. And then they're going to tell you to come back, and they're going to explain to you what your problem is. And then they're going to, they'll start treatment at that point. They're going to report you or tell you what your issue is. And then they'll start treating on the second visit, which I don't understand that, Scott. So if you come to see me, then obviously something's wrong. And I need to give you something. And I'm not saying that I'm, going to be able to fix your problem in one visit, but, I want to give you a proper diagnosis, figure out what your problem is, and then I need to give you some type of a quick fix. Now, I don't want you to be confused when I say quick fix, because a lot of times with rehab and these types of things, therapy, it might take a couple weeks, 4 to 6 visits, but I need to give you something in that visit that makes you feel better. I don't know if it's an exercise or a stretch, or if it's some type of manipulation or manual therapy, or maybe I, show you some things that you can do on your own to modify or, manage some of these things. So it's so very important that, we're able to give the patient some type of relief on that first visit. Because so many times I have patients that come in that they'll see another chiropractor and, well, how did it go? Well, I don't know. I didn't go back because they had me come in and they told me they wanted me to come back and they were going to explain what the problem was. And that confuses a lot of people. So, obviously you're there because something's wrong and you want to give them something. You want them to feel better.
And of course, one of the things that sets Tulsa Spine and Rehab apart from other clinics is the fact that you have so many different areas of expertise, so many different professionals. We know that medical professionals can be somewhat provincial, can't they? So if you go to a chiropractor somewhere, they're not going to say a lot of times, well, I can't help you. You need to go over here to a physical therapist, because they are very provincial in what they do. But that's not the case with you guys.
Sure. And, it goes back to the toolbox analogy, is that, when I was just practicing chiropractic and I was the only one in my office, what is that saying? How's it go? Like if I'm a hammer, then everything's going to look like a nail to me, And so now I've added all the, we've got a really integrated, diverse type of toolbox, so to speak. And so we're able to, make the appropriate recommendations, depending on patients' conditions or their needs. And so I'm not limited anymore with just because I think that I'm really good at what I do, but chiropractic's not going to be the fix or the treatment for all types of conditions. And so with that proper diagnosis and with trying to give the patient something on that first visit, it might be a recommendation for physical therapy or massage therapy, acupuncture, fitness, some type of exercise, naturopathic medicine, all these different things, maybe even yoga. We have, Rebecca Ward teaches yoga here in the clinic. So we're able to give them something. And so I think it also kind of develops that relationship between the provider and the patient. The patient feels, comfortable, they were explained what the issue is, and then they leave here with a little bit of something. And I'm not saying we're going to solve their problem on the first visit, but they're going to take something away from that first visit that's going to make them feel better, or they're going to have some information or some knowledge how to manage or, maybe treat themselves.
The team at Tulsa Spine and Rehab is ready to help you, whether you're experiencing pain and discomfort or if you have some fitness goals you'd like to attain. Contact them today at 918-743-3737.